next witnesses are with the Registered Nurses Association of Ontario. Good morning. You have 6 minutes for your presentation, and if you could please state your names for the official record as you begin.
Thank you very much, Mr. Chair. Good morning to all. My name is Doris Grinspun. I am a registered nurse and the CEO of the Registered Nurses Association of Ontario, or what's most known, RNAO. With me today is Cheryl Lalonde-Ogilvie, a registered nurse and nursing policy analyst with RNAO. As the professional association representing registered nurses, nurse practitioners, and nursing students in Ontario, we thank you for the opportunity to provide advice regarding Bill 84. We are actually most distressed that other groups claim to represent RNAO right in front of us, represent nurses. We represent the nurses of this province. Nurses have a unique therapeutic relationship with individuals and their families, which positions us well to ensure continuity of care that is responsive to the needs and wishes of our patients. Because of this, we are often the eyes and ears for patients, for the health system, and are likely to play a key role in assisting patients in their journey to end-of-life journey. RNs and NPs are also leaders in the design and delivery of palliative and end-of-life care, and their full utilization can strengthen access to quality services for Ontarians. However, access to palliative care continues to be challenged across the province. While NPs are authorized to prescribe medications for a client for self-administration, in Ontario, NPs are still not authorized to prescribe controlled substances, despite federal regulations being amended in 2012. The College of Nurses of Ontario and provincial government are now moving to remedy this gap with the regulatory and bylaw changes. Until that happens, these needless limitations of access to end-of-life care, including medical assistance in dying, will continue. Although the criminal code does not permit RNs to administer the medication for MAID, RNs play a significant role providing nursing care and aiding an NP or physician to provide a person with medical assistance in dying in accordance with the law. Our first recommendation, therefore, is asking for RNs to be included in the language of the bill to protect their participation in MAID by amending all sections of the various acts, including Section 2.1 and 13.8.1 and 2 of the Excellent Care Act for All, 210. Our second recommendation is to proceed with giving nurse practitioners the authority to prescribe all controlled substances in accordance with federal regulations to ensure access to MAID across the province. And let me tell you, we are the only jurisdiction that still is not moving with that. Medical assistance in dying is a very sensitive topic, as we just have heard. The debate had been sharpened by health professionals taking sides in favor or against MAID. For RNAO, MAID is no longer a topic of debate. MAID is now law and part of our publicly funded health system. Thus, while RNAO respects the right of health professionals and institutions not to be forced into providing assisting death services, we are of the strong view that in cases of conflict of belief or consciousness objection, there must be a duty to refer that applies to individual physicians and or nurse practitioners, as well as to health organizations. Thus, our last recommendation, and likely the most important for this committee, is that a section be added in this bill to include the duty to refer by physicians and nurse practitioners who have conscientious objection. In conclusion, RNAO is pleased to provide input to the Standing Committee on Finance and Economic Affairs regarding amendments to Bill 84. We believe the recommendations specified in our written submission, which you have, and our presentation today will strengthen this bill, clarify the bill, and advance health services that give Ontarians equitable and timely access to medical assistance in dying while protecting health providers from litigation. Thank you very much.
Thank you, Ms. Grinspun. This round will begin with the government side. Mr. Fraser, you have 3 minutes.
Thank you very much, Chair, and it's good to see you again. Thank you for being here. Thank you for your presentation and for your suggested amendments. And you were probably here earlier, so I'm not going to recount the things. I only have 3 minutes. I don't believe that either two of those things, the conscience rights or duty to refer, belong inside this bill. It's a bill that's very technical in nature. I do believe we have to balance those rights. I don't think you can do that inside the bill effectively. I do want to ask you about the care coordination service. I mean, I think it's a critical piece for access, which is a concern that you raised. Have you given any thought to that?
Yes, we have. We believe it's insufficient. We believe, John, that we must, inside this bill, balance conscientious objections with the rights of patients, not of health professionals. Conscientious objections of professionals with the rights of patients, and that's called duty to refer. Like any other legal services, no doctor, no nurse will say, I don't want to do dialysis, therefore I am not referring to dialysis. You would refer if you cannot, if you don't know how, or if you don't want to do that. So this is no different. This is a legal service. We have a duty to refer.
Okay, so that, no, I understood that very clearly from your presentation.
And the previous colleagues just pointed out why this needs to be actually dealt with in this bill.
And we've had this conversation before, but
yes,
just in terms of, you made, I believe that that there has to be a patient-facing entry point that can provide people with some anonymity or an ability to talk to somebody. You may be in a place where you don't want to talk to your physician or your dentist or your nurse about what you're thinking about. You may not want your family to know. And so I think it's a critical piece that will aid in access for patients. And I think, to me, that's the most important reason to get that in there. There are provisions in the bill around protection of privacy and information, which I think are critical, and you would agree, for patients. So how much time?
30 seconds.
30 seconds. So would you or would you not agree that that's an important thing to do?
It could be important, but insufficient, John. We have discussed that. A duty to refer is not instead of a duty to refer like any other legal service that we have in this province.
I just want to add, thank you very much. I just want to add to my colleague across the way who suggested somehow that I wanted to discuss things outside of Hansard. I was just offering up Jeff, from the official opposition. I think that was really unfair.
Okay, Mr. Fraser, we're trying to deal with the witnesses now. If you have a point of order, you can raise that, but I don't think that's a point of order. Mr. Urick, you have 3 minutes.
Thanks very much, Chair. And John, we can talk about that any time. We don't need to chew up committee time with this. Thanks, Doris, for being here today. And your first two recommendations I want to touch upon, including RNs into the language of the bill. How did that get missed out in the drafting of the legislation? I'm sure you were part of the process.
Because I think that the bill says currently physicians, nurse practitioners, and other health professionals. So I guess we are included in others. But if you think about RNs, likely, if you take that they will be with the physician or they will be with the NP, they're the ones that will be most of the time they're taking care of patients. So it's out of respect to RNs that needs to be outlined specifically.
Okay, because you'd think with your expanding scope that we hear is coming that it would be actually a thing of respect to include the RNs into the billing. And the second recommendation with regards to nurse practitioners, the authority to prescribe. You said it's 2012 we've been waiting for this to occur?
We hear it's coming sometime in March. But until we don't see it signed and in the paper and happening, we will continue to push that agenda because it's critical. It's critical also for pain management. It's critical for palliative care, and it is critical for assistance in dying.
It's a barrier to access to not only medical assistance in dying, but as you said, other forms of treatment. Yeah. Considering we're creating more nurse practitioner-led clinics throughout
Yes.
the province, and they're expanding their scope and role.
Yes.
So is there anything else other than the 3 recommendations that you've put forward that you think we need to have a
Those 3
discussion about?
recommendations are critical, and they're critical for the reasons that we outline in the submission, and also just for the discussion up to this moment today. It proves that it's critical to have inside the law both the conscientious objection and also the duty to refer, both.
But this legislation is the place to have this discussion. And
I
this
would
talk.
suggest yes.
Thank you very much.
Thank you. Madame Jelena, 3 minutes.
Thank you. Start with the same question. You were there. Did you have, or your members, did they have an opportunity to get engaged into discussion that led to the tabling of this bill?
Yes, we wouldn't expect. Let me start with this. Let's not play politics with this. No individual nurse will be approached, nor should every individual nurse in the province be approached. Nurses, RNs, NPs, and for that matter, nursing students were heavily involved from the federal legislation, from the court challenge to absolutely this time, including in looking at the guidelines for Ontario, etc. So yes, as an association that represents RNs, NPs, and nursing students, we have been very much involved.
So how do we explain that nurses are not in the bill?
Nurse practitioners are, and
Yeah.
they are nurses. And the same answer that it was given to Jeff is given to you, France, which is likely because they included us under other. For us, that's insufficient given the tremendous role that RNs play in the system. So I hope that you too and the government will help to remedy that.
I agree with you that as long as I don't see it in writing, I won't believe that our NPs will finally be able to prescribe narcotics, so we will keep pushing. Coming back to effective referral, so it's not in the bill. What do you fear by not having it in the bill?
Well, the same type of discussions that we heard in the previous 2 presentations. To me, is as a health professional, as an association, and I know that there are a couple of nurses presenting from the same group. It is unconscionable that any health professional will take law into their hands. We all have beliefs. We all have, whether it's religious, whether it's moral, whether it's other type of beliefs. This is about patients and the public in Ontario. This is about a legal service that is available now to them. This is their choice, not my individual choice. I may oppose to provide the service, as I may oppose to provide another service because I'm incompetent to provide dialysis, for example, but I have a duty to refer. So this is the position of the association. And let me tell you, we represent 41,000 RNs, NPs, and nurse practitioners. And perhaps there is a 2% not on site. All the rest is totally on site. In fact, RNAO was the first organization to put at their AGM 4 years ago a motion to the members to have the discussion, including medically assistant in dying, and passed by 93%.
Thank you, Ms. Grinspun. That's all our time for today. If you'd like to submit something further in writing, you have until 6 p.m. on Thursday, March 30th.
Thank you so much.